Welcome to USMLEFasttrack.com.
This video is going to cover the entire pathology section starting on page 212 from the first aid for the USMLE Step 1, 2013 edition. A few helpful tips while watching these videos is that if you would like to pause the video, hit the spacebar on your keyboard. To fast forward the video by 3 seconds, hit the right arrow key on your keyboard. And to go back 3 seconds in the video, hit the left arrow key. Apoptosis. What is apoptosis? Apoptosis is programmed cell death. So this is the clean way cells die. Is ATP required in apoptosis? Yes, ATP is required in apoptosis. What are the two pathways of apoptosis? The two pathways include intrinsic or extrinsic pathways. What mediates cellular breakdown in apoptosis? Activation of cytosolic caspases is what mediates cellular breakdown. One important thing to note about apoptosis is that there is no significant inflammation in apoptosis, and this is why it's considered a clean way of cells to die. Hence the term programmed cell death. Describe what all happens in apoptosis. Apoptosis is characterized by cell shrinkage, nuclear shrinkage, which is also known as pycnosis, basophilia, membrane blebbing, nuclear fragmentation, which is karyorrhexis, and the formation of apoptotic body, which are then phagocytosed. So just remember that in apoptosis, first the cell and the nucleus both go through shrinkage process, followed by it getting broken up into fragments, and then it eventually gets engulfed by phagocytes. What is pycnosis? Pycnosis is nuclear shrinkage. What is karyorrhexis? Karyorrhexis is nuclear fragmentation. Intrinsic pathway of apoptosis. Describe the intrinsic pathway of apoptosis. The intrinsic pathway of apoptosis is activated when there is a change in the proportion of anti- and pro-apoptotic factors. So as you can see here in the picture, when there is an increase in the pro-apoptotic factors and a decrease in the anti-apoptotic factor, the activation of the intrinsic pathway will occur. And so when this happens, the mitochondria will release cytochrome C, and this will activate cytosolic capsases, which will then go ahead and cause a cellular breakdown. Name a common pro-apoptotic protein. A common apoptotic protein is BAX. Name a common anti-apoptotic protein. A common anti-apoptotic protein is BCL2. Name some instances when the intrinsic pathway is activated. Intrinsic pathway is activated in tissue remodeling and embryogenesis. Intrinsic pathway occurs when growth factor is withdrawn from proliferating cell population, such as when there is a decrease in the interleukin-2 after a completed immune reaction, and this leads to apoptosis of the proliferating effector cells. Intrinsic pathway of apoptosis also occurs when the cells are exposed to injurious stimuli, such as radiation, toxins, or hypoxia. Extrinsic pathway of apoptosis. Describe how extrinsic pathway of apoptosis is activated. As the name suggests, the extrinsic pathway is activated from signals that come from outside of the cell. So in extrinsic pathway, there is no involvement of pro and anti-apoptotic protein. And the signals that will activate the extrinsic pathway includes the ligand receptor interactions, as well as immune cells can also activate the extrinsic pathway. Describe the ligand receptor interaction in the extrinsic pathway of apoptosis. In ligand receptor interaction, Fas ligand will bind to FASR, which is CD95, and this leads to activation of the cytosolic capsases, and that results in cellular breakdown. Describe how immune cells causes an activation of the cytosolic pathway of apoptosis. The way this happens is that the killer T cells will cause the release of perforin and granzyme B, which will enter the cell and cause an activation of the cytosolic capsases that will eventually lead to cellular breakdown. Necrosis. What is necrosis? Necrosis is defined as enzymatic degradation and protein denaturation of a cell resulting from exogenous injury. One thing to note about necrosis is that this is not a type of programmed cell death, so that means there is inflammatory process that does occur because this is not a natural process, and in this, when there is an injury, the intracellular components will extravasate, and extravasate just means that it will squeeze out basically. Name all the different types of necrosis. The different types of necrosis includes coagulative necrosis, liquefactive necrosis, caseous necrosis, fatty necrosis or fat necrosis, fibrinoid necrosis, and gangrenous necrosis. Name the organs where you typically see coagulative necrosis. You see coagulative necrosis in the heart, liver, and the kidneys. Where does liquefactive necrosis occur? Liquefactive necrosis can occur in the brain and the lungs, and it happens due to bacterial abscesses and pleural effusion. Define pleural effusion. Pleural effusion is excess fluid that accumulates in the pleura, and pleura is the fluid-filled space that surrounds the lungs. In what situation can caseous necrosis occur? Caseous necrosis can occur in tuberculosis and systemic fungal infections. Define fat necrosis. Fat necrosis is a type of necrosis that occurs due to digestive enzymes such as lipase. What are some conditions that can lead to fat necrosis? Fat necrosis can happen in trauma as well as in acute pancreatitis. Fat necrosis can also happen in the breast due to a traumatic injury, which could be a sign of physical abuse. Where is fibrinoid necrosis generally observed? Fibrinoid necrosis generally occurs in the blood vessels. Where does gangrenous necrosis commonly occur? Gangrenous necrosis commonly happens in the limbs and in the GI tract. What is dry gangrenous necrosis? Dry gangrenous necrosis is a ischemic coagulative gangrenous necrosis. What is wet gangrenous necrosis? Wet gangrenous necrosis is when there is gangrenous necrosis with bacteria. Cell injury. What is reversible cell injury? Reversible cell injury is a type of injury that can be reversed with oxygen. Reversible cell injury is generally considered injury in its starting phase, so the injury has not gotten so bad that it's irreversible, so when oxygen is restored, the injury can be reversed. What are the characteristics of reversible cell injury? In reversible cell injury, there is decrease in ATP synthesis, and when there is decrease in ATP synthesis, this leads to cellular swelling, and we know that because of low or no ATP, this would lead to impairment of the sodium-potassium pump. So that's why, because of low ATP, there would be cellular swelling. There would also be nuclear chromatin clumping, decrease in glycogen, fatty change, and ribosomal detachment due to decrease in protein synthesis. Name the characteristics of irreversible cell injury. In irreversible cell injury, there is nuclear pycnosis, nuclear karyolysis, and karyorrhexis. In irreversible cell injury, due to the calcium influx, there would also be caspase activation, therefore leading to cellular breakdown. There is also plasma membrane damage, lysosomal rupture, and mitochondrial permeability. So with any of these situations, the cell has got to a point of no return. So therefore, this is irreversible cell injury. Ischemia, susceptible areas. Why is it important to understand that some areas in the body are susceptible to hypoxia? The reason this is important to know is because there are certain areas of the body that receives distal blood supply, which means that it's already poor in oxygen. So because these areas are already in normal situation receiving oxygen poor blood supply, any further decrease in blood supply will therefore lead to some sort of problems. Name the areas in the brain susceptible to hypoxia and ischemia or infarction. The areas in the brain susceptible to hypoxia includes the ACA, which is the anterior cerebral artery, MCA, which is the middle cerebral artery, and PCA, which is the posterior cerebral artery. Name the area of the heart susceptible to hypoxia and ischemia or infarction. The area of the heart susceptible to hypoxia is the subendocardium of the left ventricle. What area of the kidney is susceptible to hypoxia and ischemia or infarction? The areas of the kidney susceptible to hypoxia is the straight segment of the proximal tubule in the medulla, as well as the thick ascending limb in the medulla. What area of the liver is susceptible to hypoxia and ischemia or infarction? The area of the liver susceptible to hypoxia is the area around the central vein, which is the zone 3. What area in the colon is susceptible to hypoxia and ischemia or infarction? The area in the colon that is susceptible to hypoxia is the splenic flexure and the rectum. What is the watershed area? Watershed area is any area that receives dual blood supply from most distal branches of two arteries. So in this situation, just because of that dual blood supply, there is adequate amount of oxygen going to this area. So if one of those things were to be blocked up, it would receive in hypoxia, and that's why these areas, the ones that receive dual blood supply, are one of those areas susceptible to hypoxia. Name the cells that are most commonly affected in hypoxic ischemic encephalopathy or HIE. In HIE, the cells that are primarily affected are the pyramidal cells of the hippocampus and Purkinje cells. Infarcts, red versus pale. What is another name for red infarct? Another name for red infarct is hemorrhagic infarct. What is another name for pale infarct? Another name for pale infarct is anemic infarct. Where does red or hemorrhagic infarct occur? Red or hemorrhagic infarct occurs in loose tissue with collateral or dual circulation, such as liver, lungs, and intestines. Red infarct can also occur following reperfusion. Why does red or hemorrhagic infarct occurs following reperfusion? The reason this happens is because in reperfusion injury there is damage that is caused by free radicals. What is the mnemonic to help you remember red or hemorrhagic infarct? Just remember red equals reperfusion, so that's RE in red and RE for reperfusion. Where does pale infarct commonly occur? Pale infarct commonly occurs in solid tissues with single blood supply, such as in the heart, kidneys, and the spleen. Shock. What is hypovolemic shock? Hypovolemic shock is shock due to low blood volume levels. What is cardiogenic shock? Cardiogenic shock is when shock occurs due to decrease in heart functions. What is septic shock? Septic shock is a serious condition that occurs when an overwhelming infection leads to life-threatening low blood pressure, and the reason this happens is because there is peripheral vasodilation. Name all the features of hypovolemic or cardiogenic shock. In hypovolemic or cardiogenic shock, there is low output failure. That means the heart is not able to pump out enough blood, and this could be due to decrease in heart functioning or due to low blood volume. And when the body does not get enough blood due to decrease in heart function or low blood volumes, it will increase TPR, which is the total peripheral resistance, just to compensate for that. So when the compensation by increasing TPR is not enough, the body goes into hypovolemic or cardiogenic shock. And so in hypovolemic or cardiogenic shock, the blood is going to try to get away from all the peripheral tissues, such as the skin, and get to all the vital organs, just because whatever amount of blood that's circulating gets to all the vital organs, just to make sure at least the vital organs are functioning properly. And by doing this, there is going to be vasoconstriction, and this leads to cold and clampy skin. What are all the features of septic shock? In septic shock, there is uncontrollable vasodilation throughout the body. And so in septic shock, the blood is moving away from the vital organs and going to all the peripheral tissues. And therefore, this is considered the high output failure. There is also decrease in the total peripheral resistance. So this decrease in total peripheral resistance is also making the blood go away from the vital organs to the peripheral tissues. Septic shock also causes dilated arterioles and high venous return, and the patient with septic shock is usually hot because of all the vasodilation. There is more blood supply to the periphery, therefore the patient becomes hot. So that's how you sort of differentiate between hypovolemic and cardiogenic shock, because in hypovolemic and cardiogenic shock, because all the blood is trying to go to all the vital organs, the person becomes cold and clammy, versus in septic shock, when the blood is trying to get away from all the vital organs and going into the periphery, the patient becomes hot. Atrophy. What is atrophy? Atrophy is the reduction in the size or number of cells. Name all the causes of atrophy. The causes of atrophy can be normal in cases of menopause when there is a decrease in hormones, and that leads to atrophy of the vagina and the uterus. Atrophy will also occur when there is diminished innervation, which happens in motor neuron damage, and this leads to atrophy of the muscles. Atrophy will also occur when there is a decrease in blood flow and decrease in the amount of nutrients. Atrophy also results from increase in pressure, which happens in nephrolithiasis, and that just means kidney stones. So this will lead to increase in pressure and therefore atrophy. And lastly, atrophy can occur due to occlusion of the secretory ducts, and this happens in cases of cystic fibrosis. Inflammation. What are all the Latin terms and their definition used to characterize inflammation? Inflammation is characterized by rubor, which is redness, dolor, which is pain, calor, which is heat, tumor, which is swelling, and functio lasse, which is the loss of function. So these are all the things that occurs in inflammation. What are the vascular components of inflammation? In inflammation, there is increase in vascular permeability, there is vasodilation, and endothelial injury. And the reason vascular permeability and vasodilation occurs in inflammation is to allow the inflammatory cells to get to the site of inflammation. What is the cellular component of inflammation? The cellular component of inflammation is when neutrophils extravasate from circulation to the injured tissue, and there the neutrophils then will participate in inflammation through phagocytosis, degranulation, and inflammatory mediator release. Name all the things that mediate acute inflammation. Acute inflammation is mediated by neutrophils, eosinophils, and antibodies. Describe the onset and duration of acute inflammation. Acute inflammation has a rapid onset where it starts from seconds to minutes, and it can last for minutes to days. What are the potential outcomes of acute inflammation? Acute inflammation can have three outcomes where it can completely resolve, it can lead to abscess formation, or it can progress into chronic inflammation. What cells mediate chronic inflammation? Chronic inflammation is mediated by mononuclear cells such as macrophages. Describe the process of chronic inflammation. In chronic inflammation, there is persistent destruction and repair, along with blood vessel proliferation, fibrosis, and eventually a formation of granuloma. What is the eventual outcome of chronic inflammation? The outcomes of chronic inflammation include scarring and amyloidosis. What is a granuloma? A granuloma is a nodular collection of epithelioid macrophages and giant cells, and granulomas are formed when the immune system attempts to wall up substances that it perceives as foreign objects but is unable to eliminate them. So in this case, it forms it into a granuloma, which is considered a property of chronic inflammation. Leukocyte extravasation. Briefly describe the picture of leukocyte extravasation. To understand leukocyte extravasation, we first of all will understand the whole thing that happens. Firstly, neutrophils inside the lumen of your blood vessels is moving along normally. So it's inside the lumen, it goes about doing its own thing inside the lumen. Now there are some neutrophils that like to hang around close to the endothelium. In this area, the way they travel along is by rolling, and the way they roll is by protein-protein interaction. So as you can see here in the picture, the PMN, which stands for the polymorphonuclear leukocyte, also known as a granulocyte, will have a protein called sialyl Lewis X, and that attaches to the E-selectin or P-selectin to perform that rolling action. So as this rolling action is continuing close to the endothelium, if there is any sort of inflammation, this will cause the endothelial cells to express proteins such as ICAM. So as you can see here in the picture, at the level of inflammation, the endothelial cells will express proteins like ICAM. And whenever ICAM is expressed, whenever the neutrophils detect this, the rolling action will stop at this level. So as you see here in the picture, the rolling is stopping at this level. Once the rolling has stopped at the level of ICAM, and this will lead to the neutrophil squeezing out and going into the interstitium, and this process is called diapedesis. And once the neutrophil is out into the interstitium, it will follow bacterial products and cytokines to get to the site of injury and cause inflammation. What is expressed by the vasculature or the stroma that allows neutrophils to roll along the side of endothelium? The vasculature or the stroma expresses E-selectin or P-selectin that helps neutrophils roll along the side of the endothelium. What is expressed by the leukocyte that attaches to that E-selectin or P-selectin? Leukocytes express a sialyl Lewis X protein that attaches to that E-selectin or P-selectin in order to perform that rolling action. What is expressed by the vasculature or the stroma to stop the neutrophils by creating tight binding? The vasculature or the stroma will express ICAM1 that will cause the neutrophils to stop at this area by causing tight binding. What protein of leukocyte will bind to ICAM1 to cause that tight binding? LFA1, also known as integrin, will bind to that ICAM1, and this will cause a tight binding, which will cause the neutrophils to stop rolling at this level. What happens after tight binding in leukocyte extravasation? After tight binding, there is diapedesis when the leukocytes travel between endothelial cells and exit the blood vessels. What protein is expressed by the vasculature and stroma as well as with leukocytes that causes diapedesis? The protein that's expressed at this level is the PCAM1. What is the next step after diapedesis and leukocyte extravasation? After diapedesis, the next step is migration, when the leukocytes travel through interstitium to site of injury or infection guided by chemotactic signals. Name the cytokines that the neutrophils will follow to get to the site of injury. Neutrophils will follow cytokines such as C5a, interleukin 8, LTB4, and kallikrein. What is the mnemonic to help you remember some of these cytokines? The mnemonic just remembers silk, or C-I-L-K, and that C stands for C5a, I is for the interleukin 8, L is for the LTB4, and the K is for kallikrein. Free radical injury. What is free radical? Free radical is an atom, molecule, or an ion that has an unpaired valence electron, which makes them highly reactive. What are some ways that free radicals can cause damage? Free radicals damage cells via membrane lipid peroxidation, protein modification, and DNA breakage. How can free radicals be created inside our body? Free radicals are created inside our body via radiation exposure. They can be created in phase 1 drug metabolism, also by redox reaction, by nitric oxide, transition metals, and also with leukocyte oxidative burst. What are some ways that free radicals can be eliminated from the body? Free radicals can be eliminated by enzymes such as catalase, superoxide dismutase, and glutathione peroxidase. Free radicals can also go through spontaneous decay, and antioxidants can also eliminate them, such as vitamin A, C, and E. What happens if the enzymes or the antioxidants are not able to eliminate free radicals? In case enzymes or antioxidants are not able to eliminate free radicals, the free radicals will build up in the body and therefore cause damage. How can oxygen cause free radicals? Even though we need oxygen to live, too much oxygen can lead to formation of superoxide, and this will cause free radical damage. What are some pathologies that occur due to free radical injury? Free radical injury can lead to retinopathy of prematurity, bronchopulmonary dysplasia, and both of these things happen due to giving too much oxygen. Other free radical pathologies are due to drugs or poisons such as carbon tetrachloride, which can lead to liver necrosis. Acetaminophen overdose can lead to fulminant hepatitis, and iron overload can lead to hemochromatosis. Define the word fulminant. Fulminant just means that it has a severe and sudden onset. Wound healing. What are the 3 phases of wound healing and its time frame? The 3 phases of wound healing includes inflammatory, proliferative, and then finally remodeling. Inflammatory action of wound healing occurs immediately after a wound has been created. Proliferative action occurs 2 to 3 days after, and remodeling comes 1 week after wound has been created. And you can think of all these 3 things as first, which is inflammation, and that is the start of wound healing. Then is the proliferative, which is the rebuild phase. And the last is remodeling, and this is when the scar tissue is starting to form. What are the mediators of inflammation? The mediators of inflammation is platelets, neutrophils, and macrophages. What are all the mediators of proliferative phase? The mediators that are active in the proliferative phase are the fibroblast, myofibroblast, endothelial cells, keratinocytes, and macrophages. What is the mediator of remodeling to form scar tissue? The mediator in remodeling is fibroblasts. Describe what all happens in the inflammatory phase of wound healing. In the inflammatory phase of wound healing, there is first a clot formation. The vessels will increase its permeability, and that would allow the release of neutrophils into the interstitium. From there, it can travel to the site of injury and cause inflammation. Once this has been done, the macrophages will clear the debris 2 days later. Describe the proliferative phase of wound healing. The proliferative phase is when deposition of granulation tissue and collagen occurs. There's also angiogenesis, in which new vessels are being formed. Epithelial cells start to proliferate. The clot that was originally formed in inflammation starts to dissolve, and wound contraction starts to occur, which is mediated by myofibroblasts. Describe what all occurs in the remodeling phase of wound healing. In the remodeling phase, type 3 collagen is replaced by type 1 collagen, and there will be an increase in tensile strength of the tissue. So in this phase, because of the formation of scar tissue, the strength of the tissue increases, but that does not necessarily mean the function is going to be the same. So when the scar tissue is being formed, there is a sacrifice of functionality because the preference is to increase the strength of the tissue. Granulomatous disease. What is a granuloma? A granuloma is when the immune system tries to wall off a substance but it's not able to, so what it ends up doing is tries to do its best by walling it off and sort of forming it into a ball, and that is a granuloma. So therefore, granulomatous disease are going to be some of those diseases that are hard to get rid of. Describe the immune reaction that will cause the formation of granulomas. Helper T cells, namely the Th1 cells, secrete gamma interferon. That gamma interferon will then activate macrophages. Macrophages then will release TNF-alpha, which is what's responsible for inducing and maintaining granulomas. What drugs are used in the treatment of granulomatous diseases? The drugs that can be used in the treatment of granulomatous disease are the anti-TNF drugs. And the reason for this is because we said that TNF-alpha from macrophages are what induces and maintains granulomas. What is one thing that you would need to check before starting somebody on anti-TNF drugs? Before starting somebody on anti-TNF drugs, you want to make sure they have not had TB, because giving anti-TNF drugs can result in granulomas to break down, leading to disseminated disease. Name all the granulomatous diseases. Granulomatous disease includes disease caused by Mycobacterium tuberculosis, which causes TB, fungal infections, which can cause diseases such as histoplasmosis and coccidioidomycosis, Treponema pallidum, which causes syphilis, Mycobacterium leprae, which causes leprosy, Bartonella henselae, which causes the cat scratch disease, sarcoidosis, and inflammatory conditions such as Crohn's disease, granulomatosis with polyangiitis, which is also known as Wegener's granulomatosis, Churg-Strauss syndrome, berylliosis, and silicosis are all examples of granulomatous diseases. Transudate versus exudate. Define transudate. Transudate is extravascular fluid with low protein content and low specific gravity. An easy way to remember transudate is just remember in transudate is when fluid goes through tight blood vessels. So in transudate, if the blood vessels are still tight, only the small molecules are going to be able to go through. So remember the fluid that's going to go through, because it's going through tight blood vessels, it's going to be a little transparent to help you remember transudate. Define exudate. Exudate is any fluid that filters from circulatory system into lesions or areas of inflammation. An easy way to remember exudate is just remember that this is what happens when there's inflammation. So there's fluid and cells that go through the loose blood vessels, because we know that in inflammation the blood vessels do become loose to allow neutrophils to go through the blood vessels as well as fluid and things like that. So remember, exudate needs to be associated with inflammation. Name all the features of transudate. In transudate, because the fluid goes through tight blood vessels, the cells are not able to go through, so therefore it's going to be hypocellular. There's also low protein content and low specific gravity of less than 1.012. Name some conditions in which you would see transudate. Transudate can occur when there is increase in hydrostatic pressure, which causes the fluid to move out of the vessels into the periphery. Transudate also occurs when there is decrease in oncotic pressure inside the vessels, which means because of the tight blood vessels, due to the decrease in oncotic pressure, the fluid is not going to be able to move in, therefore there will be transudate in the periphery. And lastly, sodium retention will also lead to transudate, because sodium will also retain water, and this excess volume in the blood vessels will increase the hydrostatic pressure, and therefore again it will lead to transudate. Name all the features of exudate. In exudate, there is going to be high cell content because, again, this is associated with inflammation, so there will be high cell content. In exudate, there is also high protein levels, and the specific gravity is greater than 1.020. Name some conditions in which you would see exudate. Exudate, you would see, again, we've mentioned it multiple times, you would see it in inflammation as well when there is lymphatic obstruction. Erythrocyte sedimentation rate. What is erythrocyte sedimentation rate and how does it work? The way erythrocyte sedimentation rate works is that product of inflammation such as fibrinogen will coat to the RBCs, and this will cause the RBCs to aggregate. When the RBCs are aggregated, they become heavier and they will fall down at a faster rate within the test tube. So erythrocyte sedimentation rate is one way of detecting inflammation. What are the conditions that would lead to increase in erythrocyte sedimentation rate? Erythrocyte sedimentation rate will increase in infections, inflammation such as in temporal arteritis, cancers, pregnancy, and lupus. Name some conditions that would lead to a decrease in erythrocyte sedimentation rate. Erythrocyte sedimentation rate would decrease in sickle cell anemia due to the altered shape of the RBCs. Also in polycythemia and congestive heart failure, the erythrocyte sedimentation rate would decrease. Iron poisoning. Why is iron poisoning clinically important to know? The reason iron poisoning is clinically important to know is because it's one of the leading causes of fatalities from toxicologic agents in children. And the reason for this is iron pills look like candy, and therefore children will eat a lot of this and get iron poisoning. What is the mechanism in which iron poisoning causes damage? The way iron poisoning causes damage is due to free radical formation, and this leads to cell death due to peroxidation of membrane lipids. What are the acute symptoms of iron poisoning? The acute symptoms of iron poisoning is gastric bleeding. What are the chronic symptoms of iron poisoning? The chronic symptoms of iron poisonings are metabolic acidosis and scarring leading to GI obstruction. What drug is an antidote of iron poisoning? The drug used as an antidote in iron poisoning is deferoxamine. Amyloidosis. What is amyloidosis? Amyloidosis is abnormal aggregation of protein or their fragments into beta-pleated sheet structures. So when this abnormal accumulation of protein occurs, it leads to cell damage and apoptosis. Describe the histologic viewing method of amyloidosis. Amyloidosis is seen using Congo red stain, and it appears to have an apple green bifringence under polarized light, and the affected tissue seems to have a waxy appearance. Name the 6 different types of amyloidosis. The 6 different types of amyloidosis includes AL, which is the amyloid light chain amyloidosis, also known as the primary systemic amyloidosis. The second one is the AA amyloidosis, also known as secondary systemic amyloidosis. The third is dialysis-related amyloidosis. Fourth is heritable amyloidosis. The fifth is the age-related or senile systemic amyloidosis. And the last one is the organ-specific amyloidosis. What is AL amyloidosis? AL or amyloid light chain amyloidosis is the most common form of systemic amyloidosis in the US, and it occurs due to deposition of proteins from Ig light chains. In what situation can AL amyloidosis occur? AL amyloidosis can occur as a plasma cell disorder, or it can occur due to multiple myeloma. Name all the organ systems that AL amyloidosis can affect. Because AL amyloidosis is a systemic amyloidosis, it can have an effect on multiple organ systems, including renal, and this could lead to nephrotic syndrome. It can have an effect on the heart, which will lead to heart failure or arrhythmias. AL amyloidosis can have hematologic effects, and that would lead to easy bruising. Also, conditions such as hepatomegaly and neuropathy can all occur. What is AA amyloidosis, also known as secondary systemic amyloidosis? AA amyloidosis is a condition in which serum amyloid A proteins are deposited in tissues. Name some conditions in which you would see AA amyloidosis. AA amyloidosis is seen with chronic diseases such as rheumatoid arthritis, inflammatory bowel disease, spondyloarthropathy, and chronic infections. One additional thing to note about AA amyloidosis is just like AL amyloidosis, this also has multi-system effect, and that is why it's considered the secondary systemic amyloidosis. What is dialysis-related amyloidosis? Dialysis-related amyloidosis is a condition that occurs in patients with end-stage renal disease and long-term dialysis, in which there is beta-2 microglobulin that accumulates. Describe how dialysis-related amyloidosis presents. Dialysis-related amyloidosis often presents as carpal tunnel syndrome or other joint issues. Give an example of heritable amyloidosis. An example of heritable amyloidosis is ATTR neurologic or cardiac amyloidosis. What is the cause of ATTR neurologic or cardiac amyloidosis? The reason ATTR familial amyloidosis occur is due to transthyretin gene mutation. What is the cause of age-related senile systemic amyloidosis? The cause of age-related senile systemic amyloidosis is due to deposition of normal wild-type transthyretin in myocardium and other sites. One additional thing to note here about age-related senile systemic amyloidosis is that it has a slower progression of cardiac dysfunction when compared to AL amyloidosis. What is organ-specific amyloidosis? Organ-specific amyloidosis is when amyloid deposition is localized to a single organ. Describe how amyloidosis occurs in Alzheimer's disease. The way amyloidosis occurs in Alzheimer's disease is due to deposition of amyloid beta protein cleaved from amyloid precursor protein, which is APP. Neoplastic progression. Briefly describe the hallmarks of cancer. Before we talk about the hallmarks of cancer, it's first important to know what are the normal situations for normal cell growth. So in normal situations, growth signals are what causes the growth of a cell. There are also anti-growth signals that would inhibit the growth, and there are also apoptotic signals. Now in cases of cancer, it does not obey any of these signals and it does its own thing, and that's what we're going to talk about when we talk about the hallmarks of cancer. And those include evasion of apoptosis, self-sufficiency in growth signals, which means it does not need growth signals for it to grow, so it will grow in its own fashion. It will also have insensitivity to the anti-growth signals. It also has the sustained angiogenesis, which means it has unlimited blood supply. Cancer cells also have limitless replicative potential. And finally, tissue invasion and metastasis, which means it can break out from its normal tissue and could affect the entire body. In neoplastic progression, briefly describe how normal cells starts the initial phase of neoplastic progression. In the initial phase, the normal cells, which are generally well differentiated, so you can see here that there is the epithelial cell layer and the basement membrane, and all of this is well differentiated. And with initial mutation, there is hyperplasia and dysplasia that starts to occur. Define hyperplasia. Hyperplasia is when the number of cells have increased. Define dysplasia. Dysplasia is when there is abnormal proliferation of cells with loss of size, shape, and orientation. So hyperplasia is basically normal cells that start dividing rapidly, whereas dysplasia is abnormal cells that start dividing more rapidly. Describe the progression from hyperplasia and dysplasia to carcinoma in situ. The next step in neoplastic progression is for cells that are in hyperplasia or dysplasia to progress on to become carcinoma in situ, and this is the pre-invasive phase. The reason this is the pre-invasive phase is because the neoplastic cells have not yet invaded the basement membrane, but the mutation level has increased. What are all the features of carcinoma in situ? Carcinoma in situ consists of neoplastic cells that have not yet invaded basement membrane, and this is why it's still considered the pre-invasive phase. There is also high nuclear cytoplasmic ratio as well as clumped chromatin, and the neoplastic cells have rapidly divided to encompass the entire thickness. Briefly describe the phase of carcinoma in situ, which is the pre-invasive phase, progressing on to the invasive carcinoma phase. The carcinoma in situ phase becomes invasive carcinoma when the cells invade through the basement membrane, and this is then considered locally invasive cancer. Name all the features of the invasive carcinoma phase. In the invasive carcinoma phase, the cells have invaded basement membrane using collagenases and hydrolases. One way to help you remember these enzymes is just remember that the basement membrane is just collagen that is held together by bonds that can be easily hydrolyzed. What is the next progression step for locally invasive carcinoma?
Building and
For
rebuilding
locally
will
invasive
eventually cause
carcinoma,
something
the
to mess
next
up in the
step
cell
is to
cycle,
metastasize.
therefore eventually leading to
Define
cancer.
metastasize.
What cancer
Metastasize
can be
means
caused
that the
by
cancer can
human
spread
T
to a distant
lymphotropic
organ.
virus
So
1.
the mutation of
Human
cells
T
have gotten to a
lymphotropic
point
virus
where
1
they
or
are now able to survive
HTLV1
in a distant
can lead
location.
to adult
So it has
T-cell
gotten the ability
leukemia
to
or
survive immune
lymphoma.
attacks.
What cancer
How
can
do
be caused by
carcinomas typically
infection with
spread in the
hepatitis
body?
B and hepatitis
Carcinomas
C
spread through
virus?
lymphatic vessels.
Hepatitis B and
How do
hepatitis C virus
sarcomas
can eventually
typically
lead
spread
to
through the body?
hepatocellular
Sarcomas
carcinoma.
typically spread through
Name
the
all
body.
the cancers that can be caused by infection with Epstein-Barr virus. Epstein-Barr
What
virus
is
is associated
hyperplasia?
with Burkitt's
Hyperplasia
lymphoma,
is when there is an
Hodgkin's
increase in the number
lymphoma,
of cells.
nasopharyngeal
The word hyper
carcinoma,
means more.
and CNS
What
lymphomas
is
in immunocompromised
metaplasia?
patients.
Metaplasia
Name the
means
cancers
one
that
adult
can be
cell
caused
type
by
is
human
replaced by another cell
papillomavirus.
type. The
Human
word meta means
papillomavirus
change.
is associated with
What is
cervical
the cause of
carcinoma, and it's
metaplasias?
caused by
Metaplasia often
HPV-16
occurs
and
due to irritation
HPV-18.
or environmental
HPV infection
exposures.
can also cause
Give an
penile
example
and
of
anal
metaplasia.
carcinomas, as
An
well as
example of
upper
metaplasia
respiratory
would be when there is squamous metaplasia in trachea and bronchi of smokers, and this is due to the constant irritation due to smoking. What is dysplasia? Dysplasia is when there is abnormal growth of cell with loss of cellular orientation, shape, and size in comparison to normal tissue. And dysplasia is generally considered pre-neoplastic. Plasia definitions: irreversible plasias. What is anaplasia? Anaplasia means abnormal cells lacking differentiation, and these cells resemble primitive cells of the same tissue. The prefix ana means backward, so it makes sense that these cells are regressing to become undifferentiated and going backward to its primitive cell of the same tissue. What is neoplasia? Neoplasia is a clonal proliferation of cells that is uncontrolled and excessive. Neoplasias can be benign or malignant. The prefix neo means new, so that means that these cells are going to be new and they're going to be out of control in the way they grow. What is desmoplasia? Desmoplasia is the fibrous tissue formation in response to neoplasm. The prefix desmo means to join or to bond, so that can sort of help you remember desmoplasia. Tumor grade versus stage. How is tumor grade determined? Tumor grade is determined by the degree of cellular differentiation based on histologic appearance of individual tumor. So the grade is basically determined by how it looks under the microscope, and it's usually graded from 1 to 4. What does low grade of 1 indicate? Low grade of 1 indicates that it's well differentiated. That means that it looks the most normal. What does grade 4 high grade indicate? The grade 4 high grade indicates that it's poorly differentiated. That means it's more chaotic and it's anaplastic. Does the grade of a tumor or the stage of a tumor have more prognostic value? The stage of the tumor has a more prognostic value than the grade does. What does staging of a tumor help you determine? Staging of a tumor helps you determine the degree of localization or spread based on the site and the size of the primary lesion. Staging will also let you know if there is spread to regional lymph nodes along with presence of metastasis. What does TNM of staging system stand for? T stands for the tumor size, N stands for node involvement, M stands for metastasis. And metastasis is the most important prognostic factor. So basically when you want to determine the stage a cancer is in, you have to look at all these things: tumor size, node involvement, and metastasis. Briefly, differentiate the grading and staging of a tumor. Tumor grade is determined microscopically, whereas stage is macroscopically. Tumor grading does not have prognostic value, whereas staging does have prognostic value. Tumor nomenclature. What does the suffix oma mean? The suffix oma generally means that it's a type of benign tumor, with certain exceptions such as lymphoma, which is actually a malignant condition. What are the two benign tumors of epithelial origin? The two benign tumors of epithelial origin is adenoma and papilloma. Name all the benign tumors of mesenchymal origin. The benign tumor of mesenchymal origin includes blood vessel tumors, which are the hemangiomas, smooth muscle tumors, which are the leiomyomas, the striated muscle tumors, which are the rhabdomyomas, connective tissue tumors, which are the fibromas, bone tumors, which are the osteomas, and the fat tumors, which are the lipomas. Name the malignant tumors of epithelial origin. The malignant tumors of epithelial origin include adenocarcinoma and papillary carcinoma. What does the term carcinoma imply? The term carcinoma implies that it has an epithelial origin and it generally spreads through lymphatic vessels. What does the term sarcoma imply? The term sarcoma implies that it has a mesenchymal origin and it typically spreads through blood vessels. And both of these terms imply malignancies. Name the malignant tumors of mesenchymal origin. The malignant tumors of mesenchymal origin includes leukemias, lymphomas, angiosarcoma, leiomyosarcoma, rhabdomyosarcoma, fibrosarcoma, osteosarcoma, and liposarcoma. Tumor differences. What is a benign tumor? A benign tumor is a well-differentiated tumor that is slow-growing, well-demarcated, with no metastasis. What is a malignant tumor? A malignant tumor may be poorly demarcated, erratic growth, locally invasive or diffused, and it may also metastasize. One additional thing to note about benign tumors is even though they are benign, it does not necessarily mean they will not cause a lot of trouble in the body.
Benign tumors, just based on their size, can cause significant trouble in the body because they might be able to compress nearby structures. What is cachexia? Cachexia is weight loss, muscle atrophy, and fatigue that all occur due to chronic disease such as cancer, AIDS, heart failure, or tuberculosis. What are the mediators of cachexia? Cachexia can occur due to actions of TNF-alpha, which is otherwise nicknamed cachectin, as well as interferon gamma and interleukin-6. So based on the actions of these cytokines, it would lead to all those things such as weight loss, muscle atrophy, and fatigue. One additional thing to note about cachexia is temporalis muscle wasting is a common finding seen in cachexia. Disease conditions associated with neoplasms. What neoplasm is Down syndrome associated with? Down syndrome is associated with acute lymphocytic leukemia, also known as ALL, as well as acute myelogenous leukemia, AML. What neoplasm is xeroderma pigmentosum and albinism associated with? Xeroderma pigmentosum and albinism is associated with melanoma, basal cell carcinoma, and especially squamous cell carcinoma of the skin. What neoplasm is chronic atrophic gastritis, pernicious anemia, and post-surgical gastric remanence associated with? Chronic atrophic gastritis, pernicious anemia, and post-surgical gastric remanence are all associated with gastric adenocarcinoma. What clinical features are observed in tuberous sclerosis? The features of tuberous sclerosis include facial angiofibroma, seizures, and mental retardation. What neoplasms are associated with tuberous sclerosis? The neoplasm associated with tuberous sclerosis includes giant cell astrocytoma, renal angiomyolipoma, and cardiac rhabdomyomas. What is actinic keratosis? Actinic keratosis is an overgrowth of skin layer resulting from extended exposure to the sun. What neoplasm is associated with actinic keratosis? The neoplasm associated with actinic keratosis is squamous cell carcinoma of the skin. What is Barrett's esophagus? Barrett's esophagus is a disorder in which the lining of the esophagus is damaged by stomach acid, and this causes the cells in the lining of the esophagus to change similar to that of the stomach. So Barrett's esophagus occurs due to chronic GI reflux. What neoplasm is associated with Barrett's esophagus? The neoplasm associated with Barrett's esophagus is esophageal adenocarcinoma. What is Plummer-Vinson syndrome? Plummer-Vinson syndrome is a condition that can occur in people with long-term chronic iron deficiency anemia, and people with Plummer-Vinson syndrome have difficulty swallowing due to small, thin growth of tissue that blocks the upper food pipe. What neoplasm is associated with Plummer-Vinson syndrome? The neoplasm associated with Plummer-Vinson syndrome is squamous cell carcinoma of the esophagus. What neoplasm can occur due to cirrhosis caused by alcohol or hepatitis B or C? In cases of cirrhosis caused by alcohol or hepatitis B or C, the neoplasm that can occur is hepatocellular carcinoma. What neoplasm is associated with ulcerative colitis? The neoplasm associated with ulcerative colitis is colonic adenocarcinoma. What neoplasm is associated with Paget's disease of the bone? The neoplasm associated with Paget's disease of the bone is secondary osteosarcoma and fibrosarcoma. What neoplasm can occur in chronic immunodeficiency states? In chronic immunodeficiency states, the neoplasm that can occur is malignant lymphomas. What neoplasms are associated with AIDS? Neoplasms associated with AIDS include aggressive malignant lymphomas, the non-Hodgkin's kind, and Kaposi sarcoma. What neoplasms are associated with autoimmune disease such as Hashimoto's thyroiditis and myasthenia gravis? The neoplasms associated with autoimmune diseases such as Hashimoto's thyroiditis and myasthenia gravis are lymphomas. What is acanthosis nigricans? Acanthosis nigricans is a skin disorder in which there is darker, thick, and velvety skin in body folds and creases. What neoplasm is associated with acanthosis nigricans? The neoplasms associated with acanthosis nigricans are visceral malignancies of the stomach, lung, and the uterus. What neoplasm is associated with dysplastic nevus? The neoplasm associated with dysplastic nevus is malignant melanomas. What neoplasms are associated with radiation exposure? In case of radiation exposure, the neoplasms that are associated with this includes leukemias, sarcoma, papillary thyroid cancer, and breast cancer. Oncogenes. What are oncogenes? Oncogene is a gene that has the potential to cause cancer. In tumor cells, these are often mutated or expressed at high levels and therefore can lead to cancer. And so oncogenes are responsible to cause a single gain-of-function mutation, and when there is gain-of-function mutation, this leads to increased cancer risk. In normal situation, the cells are supposed to undergo programmed cell death, which is known as apoptosis, but in cases when oncogenes are activated, those cells don't die and instead proliferate. One additional thing to note here is in order to cause cancer, only one allele needs to be mutated, and because of this fact, these becomes dominant mutations. What tumor is caused by the mutation of the ABL gene? The mutation of ABL gene will lead to chronic myelogenous leukemia, also known as CML. What is the gene product of the oncogene ABL? The gene product of the oncogene ABL is tyrosine kinase. What tumor can be caused by the mutation in the CMYC oncogene mutation? With CMYC oncogene mutation, this can lead to Burkitt's lymphoma. What does the CMYC gene code for? The CMYC gene codes for transcription factor. What tumor can be caused by the mutation of the BCL2 gene? With mutation of the BCL2 gene, this can lead to follicular and undifferentiated lymphomas. As we mentioned earlier, that BCL2 gene is an anti-apoptotic gene. So mutation of the BCL2 gene would lead to no apoptosis, and this can lead to follicular and undifferentiated lymphomas. What is the gene product of BCL2 gene? The gene product of BCL2 gene is anti-apoptotic molecule. What tumor can be caused by the mutation of the HER2 or NEU gene? The mutation of the human epidermal growth factor receptor 2 can lead to breast, ovarian, and gastric carcinomas. What is the gene product of HER2 or NEU gene? The gene product of HER2 is tyrosine kinase. What tumor can occur due to the mutation of the RAS gene? The mutation of RAS gene can lead to colon carcinoma. What is the gene product of RAS gene? The gene product of RAS gene is GTPase. What tumor can occur due to the mutation of the LMYC gene? The mutation of the LMYC gene can lead to lung tumor. Just remember that L for lung. What does the LMYC gene code for? The LMYC gene codes for transcription factor. What tumor can occur due to mutation of the NMYC gene? The mutation of the NMYC gene can lead to neuroblastoma. Just remember N for neuroblastoma. What does the NMYC gene code for? The NMYC gene codes for transcription factor. So all the MYC genes code for transcription factor. What tumors can occur due to mutation of the RET gene? The mutation of RET gene can lead to multiple endocrine neoplasia type 2A and 2B. What does the RET gene encode? The RET gene encodes for receptor tyrosine kinase. What tumor can be caused by the mutation of the c-KIT gene? The mutation in the c-KIT gene can lead to gastrointestinal stromal tumor, also known as GIST. What is the gene product of the c-KIT gene? The gene product of c-KIT is cytokine receptor. Tumor suppressor genes. Describe the function of tumor suppressor genes. Tumor suppressor genes are normally there in order to prevent cancer from occurring. So the action of tumor suppressor genes are to suppress tumor. Now if these genes are mutated, they are no longer able to perform their tumor suppressor action. Therefore, loss of function of tumor suppressor gene will lead to increased cancer risk. One additional thing to note about tumor suppressor genes is that both alleles must be lost for the expression of disease. So that makes this a recessive mutation. Briefly describe the differences between oncogenes and tumor suppressor gene mutations. In oncogenes, the genes have an increased activity and an increase in function, so the gain of function is what causes cancer, whereas in tumor suppressor genes, the genes that are normally supposed to be suppressing tumors stop suppressing tumor, therefore the tumor is able to grow and therefore leads to cancer. In oncogene, only one allele needs to be damaged in order to cause cancer. That makes it a dominant mutation, whereas in tumor suppressor gene, both allele needs to be lost in order for expression of disease, and therefore this is a recessive mutation. Describe the normal function of tumor suppressor genes. Tumor suppressor genes are usually cell cycle regulators or DNA repair enzymes, and they normally slow down rapidly dividing cells, and they fix DNA mutation before it becomes any sort of problem. And so when these are mutated, they no longer have the effect of regulating cell cycle or DNA repair, and therefore leads to cancer. What tumor can be caused by tumor suppressor gene RB? The tumor suppressor gene RB can lead to retinoblastoma and osteosarcoma. And to help you remember this, just remember RB for retinoblastoma. What is the function of the RB gene? The normal function of the RB gene is to inhibit E2F and also blocks the G1 phase from progressing to the S phase of the cell cycle. What are the consequences of the tumor suppressor gene P53 mutation? P53 mutation can lead to most human cancers as well as Li-Fraumeni syndrome. What is Li-Fraumeni syndrome? Li-Fraumeni syndrome is a rare disorder that greatly increases the risk of developing several types of cancers, particularly in children and young adults. What is the function of the P53 gene? The function of the P53 gene is to serve as a transcription factor for P21, and it blocks the G1 phase from progressing into the S phase of the cell cycle. What cancer is associated with mutation of the BRCA1 tumor suppressor gene? The cancer associated with BRCA1 tumor suppressor gene mutation is breast and ovarian cancers. What is the normal function of the BRCA1 gene? The normal function of the BRCA1 gene is to serve as a DNA repair protein. What tumor can be caused by the mutation of the BRCA2 gene? The tumors that can be caused by the mutation of the BRCA2 gene are breast and ovarian cancers. What is the normal function of the BRCA2 gene? The normal function of the BRCA2 gene is to serve as a DNA repair protein. What tumor can be caused by the mutation of the P16 tumor suppressor gene? Mutation of the P16 tumor suppressor gene can lead to melanoma. What tumor can occur due to the mutation of the BRAF tumor suppressor gene? The mutation of the BRAF tumor suppressor gene can also lead to melanoma. What is the normal function of the BRAF gene? The normal function of the BRAF gene is to make a protein called BRAF. What cancer can occur due to mutation of the APC gene? The mutation of the APC gene can lead to colorectal cancer. One additional thing to note here is that this is associated with FAP, which is familial adenomatous polyposis. What tumor is associated with mutation of the WT1 tumor suppressor gene? The mutation of the WT1 tumor suppressor gene can lead to Wilms tumor or nephroblastoma. So remember, WT1 is for Wilms tumor. What condition would occur with the mutation of the NF1 tumor suppressor gene? In NF1 tumor suppressor gene, this can lead to neurofibromatosis type 1. What is the normal function of the NF1 gene? The normal function of the NF1 gene is to serve in the RAS pathway because it is a RAS GTPase activating protein. What condition can occur with the mutation of the NF2 gene? The mutation of the NF2 gene will lead to neurofibromatosis type 2. What is the normal function of the NF2 gene? The normal function of the NF2 gene is to give rise to Merlin, also known as schwannomin. What tumor is associated with the mutation of the DPC4 gene? The mutation of the DPC4 gene can lead to pancreatic cancer. And one way to remember this is DPC is deleted in pancreatic cancer. So that's D for deleted, P is for pancreatic, and C is for cancer. What tumor can occur due to mutation of the DCC tumor suppressor gene? The mutation of the DCC tumor suppressor gene can lead to colon cancer. And one way to remember this is DCC is for deleted in colon cancer. So that's D for deleted, C for colon, and C for cancer. Tumor markers. What are tumor markers? A tumor marker is a substance found in blood, urine, or body tissues that can be elevated in cancer, among other tissue types. There are many different tumor markers, each indicative of a particular disease process, and they can be used in oncology to help detect the presence of cancers. Why are tumor markers useful? Tumor markers are useful in confirming diagnosis of cancer. They also help us monitor tumor recurrence and to monitor response to therapy. But tumor markers should not be used as a primary tool for cancer diagnosis. What is PSA and why is it used? PSA stands for prostate specific antigen, and it's used to follow prostate carcinoma. It can also be elevated in conditions such as benign prostatic hyperplasia and prostatitis. What does prostatic acid phosphatase help us detect? Prostatic acid phosphatase can help us detect prostate carcinoma. What does CEA stand for? CEA stands for carcinoembryonic antigen. Why is carcinoembryonic antigen a useful tumor marker? Carcinoembryonic antigen is a very useful tumor marker because it is produced by many cancers. It's very nonspecific, but is produced in 70% of colorectal and pancreatic cancers. It is also produced in gastric carcinomas, breast carcinomas, and medullary thyroid carcinomas. What is alpha-fetoprotein? Alpha-fetoprotein is a major plasma protein produced by the yolk sac and liver during fetal development. Name some cancers in which there would be an increase in the level of alpha-fetoprotein. Alpha-fetoprotein can be increased in cancers such as hepatocellular carcinoma, as well as non-seminomatous germ cell tumors of the ovary and testes. Name some conditions in which there would be an increase in beta-HCG. Beta-HCG is commonly increased in pregnancy, but it can also be increased in abnormal conditions such as hydatidform molds as well as choriocarcinomas. And a way to help you remember HCG is their increase in hydatidform molds, choriocarcinomas, and gestational trophoblastic disease. So that's H for hydatidform molds, C for choriocarcinomas, and G for gestational trophoblastic disease. In which cancer would there be an increase in the level of CA125? CA125 would be elevated in ovarian cancer. Name all the tumors in which there would be an elevated levels of S100 protein. The S100 protein tumor marker would be elevated in melanoma, neural tumors, and schwannomas. Name all the situations in which you would see an elevated levels of alkaline phosphatase. Alkaline phosphatase may be elevated in conditions when cancer has metastasized to the bone, liver, and in cases of Paget's disease of the bone. Name some tumors in which you would see an elevated levels of bombacine. Bombacine may be elevated in conditions such as neuroblastoma as well as in cases of lung and gastric cancers. What does the tumor marker TRAP stand for? TRAP. The tumor marker TRAP stands for tartrate-resistant acid phosphatase. In which cancer would there be an increase in the level of tartrate-resistant acid phosphatase? TRAP would be increased in hairy cell leukemia, which is a type of B-cell neoplasm. What is the mnemonic to help you remember the cancer in which the levels of TRAP would be elevated? The mnemonic is TRAP the hairy animal, because TRAP is elevated in hairy cell leukemia. Name the cancer in which the levels of the tumor marker CA19-9 would be elevated. The cancer in which CA19-9 would be elevated is pancreatic adenocarcinoma. In which cancer would the tumor marker calcitonin be elevated? Calcitonin would be elevated in medullary thyroid carcinoma. What virus is associated with human herpes virus 8? Human herpes virus 8 is associated with Kaposi's sarcoma. What is Kaposi's sarcoma? Kaposi's sarcoma is a cancerous tumor of the connective tissue, and it's often associated with AIDS disease. What cancers are associated with H. pylori infection? H. pylori infection can lead to gastric adenocarcinoma and lymphoma. What cancer can occur due to infection with schistosoma hematobium? Schistosoma hematobium can lead to bladder cancer, and that's the squamous cell carcinoma of the bladder. What cancer can be caused with infection with Clonorchis sinensis, also known as liver fluke? Infection with liver fluke, also known as Clonorchis sinensis parasite, can lead to cholangiocarcinoma. What is cholangiocarcinoma? Cholangiocarcinoma is a malignant cancer of the bile duct. Chemical carcinogens. What fungus produces aflatoxins? Aflatoxins is produced by Aspergillus. What organ does aflatoxins affect? Aflatoxins have an effect on the liver. Name the cancer that can be caused by aflatoxins. Aflatoxin can cause hepatocellular carcinoma. What organ does vinyl chloride have an effect on? Vinyl chloride has an effect on the liver. What cancer can vinyl chloride cause? Vinyl chloride can cause angiosarcoma. Name the organ that carbon tetrachloride has an effect on. Carbon tetrachloride can affect the liver. What cancer can be caused by exposure to carbon tetrachloride? Carbon tetrachloride can lead to centrilobular necrosis and fatty change. What organ do smoked foods that contain nitrosamines have an effect on? Nitrosamines have an effect on the stomach. What cancer does nitrosamines cause? Nitrosamines can cause gastric cancer. Name the larynx cancer that cigarette smoke can cause. Cigarette smoke can cause squamous cell carcinoma of the larynx. Name the lung cancer cigarette smokes can cause. Cigarette smokes can cause squamous cell and small cell carcinoma of the lungs. Name the kidney cancer that can be caused by cigarette smoke. The kidney cancer that can be caused by cigarette smoke is renal cell carcinoma. Name the bladder cancer that cigarette smoke can cause. The bladder cancer caused by cigarette smoke is transitional cell carcinoma. Name the cancer of the pancreas caused by cigarette smoke. Cigarette smoke can lead to pancreatic adenocarcinoma. What organ does asbestos have an effect on? Asbestos has an effect on the lungs. Name the cancers that can be caused by asbestos. Asbestos exposure can lead to bronchogenic carcinoma as well as mesothelioma, but remember, asbestos can cause bronchogenic carcinoma more than it will cause mesothelioma. What skin cancer can be caused by arsenic exposure? Arsenic exposure can lead to squamous cell carcinoma of the skin. What other cancer can be caused by arsenic? Arsenic can also lead to angiosarcoma. What organs do naphthalene or aniline dyes have an effect on? Naphthalene or aniline dyes have an effect on the bladder. What cancer can be caused by naphthalene or alanine dye exposure? Naphthalene or alanine dye can lead to transitional cell carcinoma. What cancer can be caused by alkylating agents? Alkylating agents can lead to leukemias. And remember, alkylating agents are the drugs used in the treatment of cancer, so cancer drugs can lead to leukemias. Paraneoplastic syndromes. What is paraneoplastic syndrome? Paraneoplastic syndrome is a disease or symptoms that is a consequence of presence of cancer in the body, and in this, the cancer secretes a hormone in a very uncontrolled fashion, and this causes a disturbance in the normal hormonal pathway. What cancer secretes adrenocorticotropic hormone or adrenocorticotropic-like peptide? ACTH or ACTH-like peptide is secreted in small cell lung carcinoma. What is the effect of increased secretion of ACTH or ACTH-like peptide? The effect of increased ACTH or ACTH-like peptide would lead to Cushing's syndrome. In what cancers would there be an increase in antidiuretic hormone? Antidiuretic hormone will be increased in conditions such as small cell lung carcinoma and intracranial neoplasms. What is the effect of increase in ADH levels? Increased ADH will lead to syndrome of inappropriate antidiuretic hormone. Name the cancers that would lead to an increase in parathyroid hormone-related proteins. The cancers that would lead to an increase in parathyroid hormone-related proteins include squamous cell lung carcinoma, renal cell carcinoma, and breast cancer. What is the effect of this increase in parathyroid hormone-related protein? The increase in parathyroid hormone-related protein will lead to hypercalcemia. Name some cancers that would lead to an increase in calcitriol. The cancers that can cause an increase in calcitriol includes Hodgkin's lymphoma and some non-Hodgkin's lymphomas. What is the effect of increase in calcitriol? An increase in calcitriol will lead to hypercalcemia. Name all the cancers that would lead to an increase in erythropoietin. Erythropoietin is increased in cancers such as renal cell carcinoma, hemangioblastoma, hepatocellular carcinoma, and pheochromocytoma. What is the effect of increase in erythropoietin? An increase in erythropoietin will lead to polycythemia. In which cancer would there be formation of antibodies against the presynaptic calcium channels at the neuromuscular junction? The cancer that causes antibodies formation against presynaptic calcium channels at the neuromuscular junction is the small cell lung carcinoma. Name the syndrome that is characterized by antibodies against presynaptic calcium channels at the neuromuscular junction. The name of this syndrome is Lambert-Eaton syndrome, in which there is muscle weakness. Psammoma bodies. What are psammoma bodies? Psammoma bodies are laminated, concentric, calcific spherules that are seen in cancers. They are essentially a round collection of calcium. Name all the cancers in which you would see psammoma bodies. You would see psammoma bodies in papillary adenocarcinoma of the thyroid, serous papillary cystadenocarcinoma of ovary, meningioma, and malignant mesothelioma. What is the mnemonic to help you remember cancers in which you would see psammoma bodies? The mnemonic, just remember PSMM. So that is all the things that are included in the word psammoma. So that's P for papillary adenocarcinoma of the thyroid, S is for serous papillary cystadenocarcinoma of ovary, M is for meningioma, and the last M is for mesothelioma. Cancer epidemiology. What is incidence? Incidence is the measure of risk of developing a new condition within a specified period of time. So it basically means the new occurrences of a disease. What is mortality? Mortality is the number of deaths that occur due to that disease. Name the 3 most common occurring cancers in male from most common to the least common. The most common occurring cancer in male is prostate cancer, followed by lung cancer, and finally colon or rectum cancer. Order the leading cause of death in the US by cancer in men from most common to least common. The leading cause of death by cancer is lung cancer, followed by prostate cancer. One thing to note here is that even though the incidence rate of prostate cancer is higher, mortality rate is low because of the fact that prostate cancer can be found early in its stages. Name the 3 most common occurring cancers in female from the most common to the least common. The most common occurring cancers in female from most common to least common is breast cancer, followed by lung cancer, and finally colon or rectum cancer. Order the most common cause of death in the US by cancer in females. The most common cause of death by cancer in female is due to lung cancer, followed by breast cancer. And again, just like prostate cancer in men, breast cancer is also detected early in females, and therefore even though incidence rate is higher for breast cancer, the rate of mortality is lower. A couple of additional things to note here in cancer epidemiology is that lung cancer incidence has dropped in men, but it has not changed significantly in women. And cancer is the second leading cause of death in the United States, just after heart disease, which is at number 1. Common metastasis. What does cancer metastasis indicate? Cancer metastasis generally indicates an advanced sign of cancer, and usually cancer at this point is at a higher stage and has poor prognosis. Where do tumors in the brain commonly metastasize from? Order them from the most common to the least common. The most common area where the brain tumors metastasize from is lung, followed by the breast, then the genitourinary tract, osteosarcoma, melanoma, and finally the GI tract. So basically, the primary tumor is located on these sites and then eventually will metastasize to the brain. What percentage of brain tumors are from metastasis? 50% of brain tumors are from metastasis. Describe the characteristic of the brain metastasis. Brain metastases are typically multiple and well-circumscribed tumors at the gray-white matter junction. Where do liver tumors commonly metastasize from the most common to the least common? Liver tumors commonly metastasize from the colon, followed by the stomach, and then finally pancreas. What are 2 of the most common sites of metastasis after regional lymph nodes? The 2 most common sites of metastasis after regional lymph nodes are the liver and lungs. Where do bone tumors commonly metastasize from the most common to the least common? Bone tumors commonly metastasize from prostate or breast, followed by the lung, and then finally thyroid or testes. Are primary bone tumors more common or bone metastasis more common? Bone metastases are much more common than primary bone tumors. What areas of the skeleton would bone metastasis commonly affect? Bone metastasis commonly affects the axial skeleton, such as the skull, spine, spinal cord, sternum, and ribs. So you should be able to see this in the whole body bone scan. What type of bone lesion would you typically see if the metastasis is from the lung? If the metastasis is from the lung, you would see lytic bone lesions. Describe the lytic bone lesions. Lytic bone lesions are destruction of bone, and this leads to resorption, and therefore you would have an increase in the level of calcium in the blood. What type of bone lesion would you see if the metastasis is from prostate? If the bone metastasis is from prostate, you would see blastic lesions. Describe blastic lesions. Blastic lesions will cause production of more bone to form, and therefore will increase bone density. What types of lesions would you see if the metastasis to the bone is from breast? If the metastasis is from the breast, you would see both lytic and blastic lesions.
This marks the end of the pathology chapter.